AI, or artificial intelligence as we know it, is superior to the human intelligence. Well, of course, that's true. It can carry out a billion processes at the same time and is quite diligent and accurate at its work. AI is being integrated into our lives in different ways. So, when the COVID pandemic situation hit us, we looked at AI to solve our problems. Today, my duo Mayank and I will be explaining two ideas that can allow AI in the detection of COVID before or almost immediately after the virus starts affecting the body. AI based radiology for X rays. AI can be used to detect COVID 19 on chest X rays with accuracy and speed using an algorithm performed like a consensus of thoracic radiologists. AI does not confirm whether a person has the virus or not. But if we can flag a patient with this algorithm, we could save the others from getting infected by that person. This can drastically improve efficiency of the AI. Moreover, being a program, it can learn basic thermal patterns of COVID and non-COVID patients, further reducing scan times and improving efficiency. AI replacing faculty in hospitals. For now, as we all know, doctors, nurses, and other faculty operating and taking care of COVID patients in hospitals are in more danger than any of us. Thus, existing medical robots with a combination of AI software and programming under human control can allow the staff to manage things easily at home. This can save the lives of the real fighters of our country in this pandemic.
The COVID 19 pandemic has had large scale implications on the global economy and financial markets. As disease outbreaks are not likely to disappear in the near future, proactive actions are required to not only save lives but also to protect economic prosperity. Furthermore, speaking on the most basic identification method, detecting and monitoring temperatures and persistent high fevers and breathing difficulties throughout the course of illness was significantly correlated with the deaths due to COVID 19. The only way to combat this is self isolation and tracking of COVID cases. For this, adding to our original plan, we have also thought of setting up various thermal cameras throughout various areas of a city to regulate the interaction between people who might have been in contact with the person who has contracted the disease. These cameras will be connected to an uplink that is integrated and efficient and will be connected to multiple monitoring stations through the integration of artificial intelligence. As you can see here, these thermal cameras can identify body temperatures, and as they are connected to an uplink, a notification can be sent to the people who have been in close contact of a possible infected person. We can also introduce this idea for detecting if people are wearing masks in social gatherings and as well as populated areas such as airports. It is of utmost importance to protect every single citizen of the country, and this idea can be expanded all over the world too. We want to ensure the protection through our AI integrated idea. This means we can reduce the total amount of infections and deaths due to an early identification of the virus. The people who will be the principal focus of concern will be the healthcare workforce, aged care workforce, disability care workforce, aged residents, and other high risk areas such as quarantines. I would like to end our presentation by saying it is not the result of the problem that defines us, but actually it is the way we act towards it. Thank you, and I hope you like our presentation.